All right, today we are diving deep into a true medical mystery. We're talking about a condition that kind of lives in the shadows, one that's notoriously tough to diagnose, and believe me, it sparks some major debate on how to treat it. This is neurogenic thoracic outlet syndrome, or NTOS for short. Just listen to this quote. It's from 1996, but it absolutely nails the challenge of NTOs, and it's just as true today as it was back then. This condition can seriously confuse both patients and their doctors, which is exactly why we're going to break it all down. So what is this thing really? Okay, imagine a super complex bundle of nerves. It's called the brachial plexus, and it's like a wiring harness running from your neck all the way down into your arm. Well, NTOS happens when that bundle gets squeezed in a really tight spot near your collarbone. And that squeezing, that compression, is what causes all the trouble. Now you might be thinking, okay, a compressed nerve sounds simple enough, right? Well, not so fast. Let's get into why this is such a misunderstood malady and start unraveling this diagnostic puzzle. This is where the real detective work begins. See, unlike a lot of other conditions, there's no single blood test or MRI that just screams, hey, you have NTOS. Instead, doctors have to become investigators. They have to methodically rule out every other possible cause for patients' symptoms until NTOS is the only logical suspect left standing. And the clues, the symptoms themselves, they just make the detective's job even harder. I mean, look at them. Radiating pain, pins and needles, weakness. These could point to a dozen different things, from a simple pinched nerve in your neck to something like carpal tunnel. This huge overlap is a massive reason why NTOS gets missed or misdiagnosed so often. And all of that leads us right to the core of the problem, the diagnostic dilemma. How on earth do you confirm a condition that's so incredibly hard to see? So here's what's so crucial to understand. Technology alone can't crack this case. The absolute foundation of a good NTOS diagnosis is good old-fashioned clinical skill. It's all about a doctor who really, truly listens to a patient's story and then performs very specific physical tests designed to provoke the symptoms and see what's going on. Now, take a look at this X-ray. It shows part of the puzzle. For a small number of patients, the cause is, well, it's right there. An extra rib, called a cervical rib, is literally crowding the space and pinching those nerves. But, and this is a huge but, for the vast majority of people with NTOS, an X-ray like this will come back completely normal, offering zero clues. Okay, so once a diagnosis is finally made, the journey forward usually starts on the conservative side. The first line of defense is going to be a very specialized kind of physical therapy to help stretch out tight muscles and improve posture. It also involves changing activities that are making the symptoms flare up. Surgery, that's usually considered the last resort. But when you get to that last resort, when surgery is on the table, well, that's when you walk into one of the biggest and most intense debates in this entire field. It's a debate that divides even the top experts. At the heart of all this controversy are two main surgical approaches. On one side, you have surgeons who prefer a rib-sparing scalenectomy. They focus on just removing the scalene muscles in the neck that they believe are doing the squeezing. On the other side, you have first rib resection. This is a much bigger operation that removes those same muscles plus a part of the first rib to really open up that space for good. The argument for the less invasive surgery is pretty compelling. I mean, as Dr. Stephen Kohler points out here, taking out the first rib can carry a complication risk as high as 18%. Compare that to just 3.6% for the muscle-only procedure. So the thinking is, if you can get good results by just releasing the muscles, why would you take on all that extra risk? But then, the counter-argument, voiced here by Dr. Robert Thompson, is just as powerful. The philosophy here is, hey, if a patient is already going through the risks of surgery, you'd better do the most complete job possible to make sure those symptoms never come back. For this camp, removing that rib is absolutely critical for long-term fix. So, where does that leave everyone? Pretty much squarely in the middle of a massive medical standoff. As the source material says, this is an area of heated opinions. And right now, there is absolutely no universal agreement on which surgery is definitively the best. And this whole surgical debate is so critical because of what can happen next, the really challenging problem of recurrent NTOs, which is when a patient's symptoms come back. So, why would symptoms come back after a major surgery? Well, a lot of times it's because that initial surgery just wasn't complete enough. Maybe little bits of muscle or rib were left behind, or the body's own healing process can backfire. Scar tissue can form and squeeze the nerves all over again, landing the patient right back where they started. Okay, so with all this debate and uncertainty, how does the medical world move past this? Well, that brings us to the quest for clarity and a look at the future of how NTOS is treated. The number one goal, the biggest mission for researchers, is to find a definitive, objective test for NTOS. The Holy Grail, really, is a tool that can reliably show and measure the nerve compression, taking all the guesswork out of the diagnosis and turning NTOs from a condition of belief into one of clear, measurable proof. And new technology is showing incredible promise. Just look at this. What you're seeing here is a dynamic MRI. On the left, with the arm down, the nerves look fine, right? But now look to the right. When the arm is raised, bam! You can physically see that nerve bundle getting squeezed in real time. This is a potential game changer. So the path forward seems pretty clear. The medical community is really focused on improving diagnostics like that dynamic MRI, digging way deeper to understand what actually causes NTOS in the first place, and of course, developing even safer, more minimally invasive ways to fix it. And that leaves us with one final and I think really crucial question. For patients who often suffer for years while being misdiagnosed or disbelieved, there's this really complex dance between the physical disease and the psychological distress it causes. The ultimate challenge then isn't just treating a compressed nerve, it's about treating the whole person.